everybody. Okay, so today's topic is get the story straight about methadone. No, I'm not on it. But I am a substance abuse counselor training, and I want to make it a little bit more understanding to any loved ones that might have somebody in their family or that they care about addicted to opioids. Okay? So there is a slight misunderstanding. A lot of people think that when their loved ones or people they know go on methadone, that it's just trading one drug for another. It's not quite like that. First of all, we never give methadone, okay, or even Suboxone without counseling and heavy testing. Okay, we're not drug dealers. We're scientists. Okay, we're counselors. We care. We're not. We're trying to heal, not keep them addicted. Okay. So, what methadone does to your loved one's brain is that methadone kind of binds to the receptors, the opioid receptors in the brain, and it blocks the high. It blocks the euphoria. All right, so that patients do not get heavy withdrawals. They don't get the sickness. They don't get the high. They get their brain into they're able to focus. They're able to get their lives back together along with motivational interviewing, okay, CBT and sometimes DBT. All those therapies are involved with that. It's not just we hand them a liquid or a shot and we're done. No, it's much more complicated. We have doctors and nurses as well as us, the counselors, that deal with your loved ones. And we take their life very seriously, okay? When people take opioids, let's say heroin, it gives them a craving like no other. And what happens is they crave, and then they do it, and they hit the euphoria, and then they crash. When they crash, they can have very dangerous withdrawals, okay? And so what methadone does is it stops the drug-seeking behavior. It brings them back to homeostasis instead of the fast release like heroin does, right? It's slow release. And like I said, it blocks those opioid receptors. That way, the client does not have the horrible withdrawals, does not crave, right? They don't crave it. There's no want, there's no crave, they're satiated, right? And then we move them into counseling the whole time. We also check their blood levels. We check their urine. Okay, now Suboxone, that's kind of a half-life. So most patients recommend, they like Suboxone. Okay, so let me get this straight. The patients or the clients like Suboxone sometimes because we're less restrictive on it. However, heroin that has better effect. Methadone has better effects. Okay, better effects on recovering, all of that. And the good thing is that it's safe to take for long term, and it's also safe to wing down. Heroin is not safe. Okay. Now, the other thing is that they think that we're not paying attention and that we might overdose their family and loved ones. No, we're not. We pay so close attention. We bring them into small rooms. It's very personal. We get to know their whole history because we serve the whole person. We don't just give them medicine, okay? I would like you guys, if you do have a loved one and you are a little unsure or have maybe some negative feelings about it, please do your research and you will see the data does not lie. Okay? There are so many success stories. In fact, some substance abuse counselors are actually recovered addicts. And they stand on what worked for them. Okay, I'm not a substance user. I don't drink. If I slur, it's because my teeth are probably slipping. um, but we're here to heal your loved ones. We're not here to hurt them. Okay? As you know, drugs have become so overwhelming. It's taking good people and making them do things that they wouldn't normally do. Right? A lot of loved ones say they don't even recognize them. They don't know them anymore. They're still there. And what they do while they're high, that's their high brain. When they're high on street drugs, right, their brain gets hijacked. All those parts of the brain that, you know, would normally tell them, no, that's not nice, you know, that's deadened, okay? Your loved one that you know and that you miss, they're still inside them. But if you give up on them, okay, you give up on them because they are sick. If you give up on them, when they do heal, you're never gonna know, right? And believe me, when people recover, they do go through counseling for the rest of their life. Sometimes it depends on what they've done, right? They have to deal with shame. They have to deal with guilt. There's nothing to be ashamed of. They were sick. But a lot of clients do feel shame. They can't believe maybe they sold their bodies. You know, maybe they did other things that they wouldn't normally do. Okay? So they've actually traumatized as well. So we serve trauma care for them as well. Without judgment, right? Nobody did drugs to get high. I mean, nobody did drugs to get addicted. All right? But addiction happens. And it can happen to the best of us. If you drink 8 cups of coffee a day, you're an addict. Huh? Yeah. Okay? If you don't have your cup, do you get headaches? Don't judge them. Try to be there for them. They need support systems. When we serve our clients, we ask them, is there anybody that you can trust that's clean, that's sober, that you can call if you're having, you know, if you're being triggered? Is there anybody? The saddest part is a lot of clients say no, because a lot of people gave up on them. Don't give up on your people. Okay, understand that they're still that same child you raised. You didn't do anything wrong. It's not your fault. They did make a choice, but now they're making another choice to get better. Okay? Please give them that opportunity. They want to come back to themselves too. They don't want to die. All right. I hope this helps somebody out there and maybe made a few things clearer. If you need any more information about recovery, please call me. Or if you need to know more about behavioral health, counseling, trauma care, any of that, please reach out. Okay? Like, share, and subscribe. Share it with somebody that might need this message. Okay? Anyways, happy Valentine's Day.